I think you can probably go ahead, Jameson.
Okay. I didn't know if Hope, did you want to kick off at all, or do you want me to just dive right in?
No, I just really appreciate everybody on this call today. I know there's a lot of moving parts in Texas, and I couldn't be happier with everybody just jumping in on the new processes and the outcomes that we're going to see today. Today, we're going to share in some successes. We're going to see some things that we need to work on. But I can't thank you enough for everybody just being a team and working as one. It really means a lot to me. And with that said, we can look at our finances, go through some things that Tricia and I want to go over, and let's have a good meeting. Thank you, Jameson.
You're welcome. Well, good afternoon, everybody. I know many of you have probably already watched the video that Lori Murray sent around, kind of the preparatory video that did walk through the overall company financial results. Wanted to just take a few minutes here in this meeting to talk more specifically about Texas as a market region and where we're at. Again, these are similar to the all company results. These are results through the first 6 months of the year. We're just now in process of finalizing the July results, so those will be disseminated shortly, but this is reflective of the first 6 months of the year. I know there's some red numbers on this page, which of course are, not the preferred shade, but, I will say that similar to what I said in the all company finance update, that, things, despite being behind where we had wanted to be from a budget perspective, I definitely think we're seeing signs of life and improvement over prior year. Generally speaking, in the Texas market, that is a positive, and I think as we move through the year, would expect to continue to see that trend. And so while we have a gap to close yet, I think there's reason to be positive and optimistic and continue to work towards our goals in this very important market. So from a revenue perspective, the 4 circles on the left of the slide here talk through revenue. I know you all have heard me say probably a couple of times this year that we had some lofty and significant budget growth expectations in the Texas market. We're not quite hitting them yet, and so we are about 13% below where we had planned to be. Dallas is the primary contributor to that miss in terms of what our expectations were there, as well as what the performance has been. Although, again, the second quarter better than the first. I think we're seeing that trend going in the right direction, and I think we're starting to make progress. And you can really see that as you look at the prior year. Houston's about 2%. Better than they were last year. San Antonio just about 4.5% better, and Dallas 28% better. So certainly a strong growth rate in Dallas. I know there's a lot of ongoing work amongst the team, and I think we're starting to see that pay off. So would expect to see the budget misses compress as the year goes on and get smaller in terms of a variance, and hopefully those prior year comparatives will continue to look better and better as the year goes on. So in total, just about 5% better than where we plan to, or than where we were last year, excuse me. The 4 circles on the right then of the slide really talk about our other cost of goods sold rate. Hopefully people will recall that this is really reflective of all the supplies and durable equipment, other than vents that we use to care for our patients. We, as well as an enterprise, had significant expectations of savings as we came together, worked to leverage the best contracts in all the locations, things like that. That was very prevalent in terms of our expectations in the Texas market for the budget. We're just not quite hitting those yet. A lot of it's been It's just taken us longer to get some of that work done than we had anticipated in terms of the budget. The good news is we're on the other side of at least a good chunk of it now from a contract perspective, and I think we're really starting to see some some savings come through. I will say July looked better and starting to trend towards our expectations. So I think those are all positive signs. And I'll in particular call out the fact that in total, all of our supply costs, they were a whole percentage point better than prior year. I know that may not seem like a lot, but when you're talking about millions of dollars of revenue, moving things a percentage point is meaningful in terms of cost savings. And if you look at Dallas and San Antonio, their improvement at almost 9% and just over 3% respectively is something that I'm excited about. And I think we're starting to see some of the value of coming together and again being able to leverage the fact that we're a much larger organization, sharing equipment, sharing supplies. I think there's been a lot of great things that have been going on, and I just thank the team for that and their ingenuity and efforts to improving some of our ratios there. The bottom four circles then really are reflective of our EBITDA. I think I've mentioned in prior meetings that this is really if you're going to remember one financial metric for the organization, this is the one you want to remember. This is indicative of the profitability of the company, really the kind of the financial health of the company, and our ability to continue to expand and serve as many kiddos as we can across the country. We do have that large miss relative to our budget. That's really reflective of what's happening on top with revenue worse than planned and our cost of goods higher than what we expected. Again, starting to see some good trend on the prior year number. We're about even with prior year, but you can see that Houston and Dallas have turned the corner. I expect San Antonio will do the same. I think that's a bit of a timing issue there with San Antonio more than anything else. But again, expecting that those will continue to trend positively as the year goes on in terms of our prior year performance and start to show growth on that EBITDA line as well. So I know that this can be a tough slide to see, but I definitely want to thank everyone for their continued efforts and just ask that people keep on going and contributing to the great mission of PHS, and the rest will kind of turn itself around. I firmly believe that. So happy to take any questions. Otherwise, I can certainly. I'm sorry, Lori, I'm not sure who's next.
I'm after you, Jameson. This is Dana.
Dana, okay.
Dana.
Thank you.
Thank you.
Hello, everyone. Happy Wednesday. All right, can you all see my screen with the Pulse M?
Yep, we're good.
Fabulous. Okay, so I'm just here to talk a little bit about a couple initiatives that are underway. The first one being Pulse M. I'm sure most of you are familiar with this, but it is a tool that we're currently using with our drivers and our clinical teams. Pulse M was put into place after we learned about it from our San Antonio branch. So they're kind of the pioneers of this tool, and it's a great example of where we truly are better together. We've learned this opportunity from our San Antonio branch and now have it launched enterprise-wide and are already starting to see some really great preliminary results. I'm here today just to talk about it, answer a couple questions, or answer any questions that might be out there, and then just remind you guys of resources that exist. So as a reminder, for Pulse M, drivers would be sending their bios on the way to the patient's home, and then also sending that pulse check once they have left the home. Clinicians, for now, we're holding off on sending the bios as COVID screenings are in place. So we didn't want to bombard our families with too much communication leading up to a visit. So once those COVID protocols are no longer in place, we'll resume normal use of Pulse M by sending the bios prior to a visit. The bio is intended to help really just introduce yourself, build that relationship. It's a kind reminder to say, hey, I'm headed out to your home. families will also have the opportunity to click on your bio within that text message just to read a little bit more about you. So if you have any customizations that you want to your bio right now, it's a generic, hi, my name is XYZ. I'm looking forward to working to meet your healthcare needs together. You can send those over to marketing@pediatrichomeservice.com and we'll get your bio updated for you. Just wanted to send a couple reminders. So introducing the pulse check before you leave the home is incredibly valuable. We're seeing some great results, and I'll dig into the Texas specific results in a minute here. But if you're able to talk with the family about the care that you've just provided and let them know that you'll be sending a survey, we're seeing great results in getting those surveys responded to and returned. It's a wonderful way for you to be able to demonstrate the amazing care you're getting or you're giving to our patients, and for our patients to be able to compliment you and PHS on the way that we're supporting our families in the community. Just a reminder to do not send a pulse check if the parent wasn't present for the visit. Obviously, input from nurses and other caregivers is valuable, but we're looking to understand the parent's experience, so the primary caregiver of the child. And then there's an FAQ document in MFiles 7122, as well as work instructions document that includes the links to the training videos that everyone participated in case you missed it or you wanted to go back and watch it again for any information. So those numbers are included there. And then I'll just go into a little bit of information about what we're seeing so far from our Texas branch. So San Antonio, Josh is leading the pack right now in terms of the Google reviews and ratings that we're seeing from a public perspective. PulseM was put in place for a couple different reasons, but from a marketing standpoint, it's really beneficial for our team to have a strategy in place where we can request those reviews from our patients who are thrilled with our service and help bolster that online public perception. So that's the numbers we're looking at here for our social reviews. In Dallas, we have Presley, Isaac, and Ashley are just doing a great job at getting those families to engage with their surveys. And then in Houston, we have Shelby, Mario, Jesse, Joe, Paige, Jennifer, and Rachel, all really kind of the early adopters of our tool so far. So if you're not seeing your name on this list, I'd encourage you to reach out to anyone on your team and understand how they're seeing success at getting those surveys to be responded to. And this is truly a practice of let's learn from each other. It's not a competition. It's not a challenge for you to go out and get as many reviews as possible. It's to get the meaningful feedback and be able to understand how we're impacting our patient families. So just a little encouragement there to learn from one another and connect to each other. Any questions on PulseM before we move on to data integrity?
Great job, everyone. That's awesome.
Yeah,
On a new rollout and have those Google reviews, that's awesome.
agreed. All right, so then the second piece I wanted to speak to is data integrity. I know you guys have heard me talking about this in the past, but there are just some key pieces of data that are really going to allow us to better understand our market spaces and the opportunities that our outreach teams have to engage with the right referral sources and spend their time at the right facilities. And so I'm just going to go over those reminders so that we can keep working towards improving our data integrity. So on a sales order, you see the ordering doctor field and you see the marketing referral field. So the ordering doctor, 100% of the time that should be in there. And right now we're pretty much hitting that mark at 100%. In the marketing referral section, we want everyone selecting this facility field and then finding the facility that referral came out of, and then finding if there was a contact associated with it. If that's a case manager, care manager, discharge planner, wanting to make sure that those fields are all filled out. The facility we need 100% of the time, and the contact we recognize that it's not going to be a case manager or discharge planner sending us a referral 100% of the time. So we recognize that field will likely be blank a portion of the time when the child's at a primary clinic or a location that doesn't have a discharge planning team. Right now, this is our current progress in Texas. So in Houston, in early June, we were at 52% of our orders had a facility on them, and we've gone down slightly there. So we have some opportunity to turn that around, and we don't have any of our facility orders that have a contact. In Dallas, we've also gone down slightly with the orders that have a facility tied to them. Also no contact. on the facility. And then the last one is in San Antonio. We've increased 6% of those sales orders with the facility. And this is looking at a rolling 6 months, just so you guys have some background on what it's all looking at. I just saw a question come through from Trish. Should these fields be updated when renewal auths are received as well for supplies and active rentals? Yes, whoever is the doctor sending us that order, we should have the updated and current information, because what we're doing as a demand generation team is connecting that revenue to the referral source so that we can understand how deep is our relationship with them. We're looking at how many patients do we have with each referral source. So it's really important to us that we have that information updated. That's all I have for you guys today.
Thank you, Dana, for everything you're doing.
Thank you guys. I mean, none of this happens without you all. So I really appreciate everyone's collaboration around Pulse M and then also this data management. I know there's so many moving parts right now, and I'm really appreciative to everyone's dedication to this effort.
And then next on the agenda, I think we have a patient success story. Polk, is that you or Trish?
Let's see, I think we,
Sorry. This month or this past month, 30 days ago, we have had the true epitome of being better together with both of our branches. We have the construction update. I'm just going to do this real quick. In Houston, 9321 is complete and they are in full functioning order. The 9349 office, we're still pending one more permit for the pharmacy to start being worked on and completed. So great picture of the door, and the paint is all on the walls. So it looks fabulous. With our better together aspect of it, we are going over our goals for each department. And I know Hoke is going to jump in on this one. Our intake goals with our intake tickets, no more than 14 days out. We have listed of where we are now, in which we will get better with both branches working together. The documentation goal with our on holds is 2.5% of our net revenue. Our customer service goals are for the WIP state for recurring orders, no more than 3 to 5 days in the WIP queue. And this will give warehouse enough time in both branches to get everything ordered that needs to come in to our warehouse for our service tech deliveries. Our warehouse goals, we have no more than $10,000 in the new status open at month end for San Antonio, and Houston, no more than 30. And this will help improve our delivery times to take care of our patients in a timely manner. And then our confirmations, 2 to 3 days from the time of delivery to the time we get it confirmed.
so Texas, so we're always challenged, right, with creating new processes and having outcomes. So I think with some of these that we're going to start showing Cameo and Jameson that are on this sheet, this is something we also can put on your boards as well. We wanted to show you these true numbers because, you know, every month we're going to go over these. And with some of the projects that we have and some of the teamwork that we're doing, I know for a fact that these will come down as we all work together on that project. As great as we work together, I mean, these numbers are always attainable if we just work together. So I want to show you true numbers and I want to show you true outcomes so we can have better processes to get to that, to get to where we need to be. So I know I know these numbers sometimes are shocking, just like Jameson says sometimes, but at the end of the day, we're all working for the same thing. So I'm excited for these to come down.
Our patient success, we had a couple of Google reviews in San Antonio, doing a shout out to Josh. He was polite. We have had, Josh is very good with our parents. And with Josh coming through on delivering this patient's machine, Josh made it very convenient for this parent since they couldn't come to the office.
Houston, Dallas, received a text from case manager at Medical City. Had to tell you, the patient told me the person that set up the oxygen seems very compassionate and caring. She was very impressed. Great job, team. The UPS delivered to neighbor's house, just spoke with case manager. She was very impressed how quickly we resolved the issue. And I know exactly which one this was too, because I was in the middle of it. So great teamwork. Speaking to Joe, and he did say that they had an issue in the past with deliveries to their address. It got delivered to the wrong one, to the gate. We went and got it, reshipped it. Case manager, everybody on the team from Houston to Dallas worked together on this one. So great job.
The RTs had their compliancy in July. Matt wanted to do a shout out to Ashley Flores. She's kept up 100% average in 4 out of the 5 audit categories. So great job, Ashley. And then in San Antonio, the RTs had their compliance as well in July. And Matt wanted to do a shout out to Jess. She's, showed tremendous improvement in audit documentation, and she received 100% on the CCA form. So way to go, Jess.
Thanks.
Great
Jessica.
job, RTs.
Thanks, Ashley. I'll do this one. Happy 15-year, Mario. You look the same as you did 30 years ago. That's from my sister, by the way. Mario has more.
Thank you.
You're welcome. More heart than families than we can even put into words. His 15-year commitment to our families and to our team as a whole is evident in his daily work. Mario has been an amazing positive attitude. I've known Mario for almost 32 years, and it's a blessing to be able to come back and work with him again and have him taking care of our patients, just like he was back in the old days. So Mario, appreciate your friendship, and I appreciate all your hard work as well. Thank you.
Thank you, Hope.
You're welcome, buddy. Q3 milestones. We have some 1 years, Raleen, Leticia, Jennifer, and Tracy. Happy 1 year.
We
Go
did
ahead.
want to do a shout out. Sorry, Hope. We did want to do a shout out to our other employees who have reached their years that are not 1, 5, 10, and 15s. So here's a list. July, Andrea, Jessica, Ed, Darius, and Kimberly. August, Bonita, Wanda, Jesse, and Jose and Joe. September, Ingrid, Pearl, Jessica, Eric, and Melissa. So happy anniversary, y'all. Hope.
Yeah, we're going to do shout outs. Houston, we are fixing the problem. I think the current quote lately is Houston, we have a problem, but we're going to change that motto and that title to we're fixing the problem. I really appreciate the great collaboration on current projects. I just want to thank everyone in the Houston branch for working together as a team and holding each other accountable. I could not be more proud. We have a lot of work to do, and we all know that. But to watch y'all work like y'all have been has been awesome. And everything we've asked you to do, you've gone above and beyond and done it. And I can't thank you enough. And I can't thank you enough for working the way you're doing in Houston. I appreciate it. San Antonio team, thank you for continued efforts, keeping San Antonio referrals excited about PHS, you know, during these rearranging times of, you know, staffing, and y'all all jumped in and did each other's jobs when people were on PTO. You worked weekends, you worked nights, and I can't thank y'all enough, San Antonio, for doing what you do. Trish and I both appreciate it from the bottom of our hearts on what y'all are doing in Houston as well. And then Dallas, y'all are rocking it. I appreciate everything. I know I haven't been up there because I heard y'all aren't going to let me back up there because I had COVID, but I am coming back. So I just appreciate and congratulate y'all for always doing the right things for our patients. The compliments we get, you know, show that the Dallas team truly cares for our kids and their families. So Dallas team, thank y'all so much for stepping up and helping us. A couple more shout outs I'd like to give is to Trish Holstead. Trish, I really appreciate what you're doing, Mandy, Cliff, and the list goes on. But for y'all to jump in and doing things that I ask y'all to do and working with me and all of us collaborating and coming up with different ideas, different strategies. It's been so much fun to have y'all at the table. So I really appreciate y'all. So thank y'all.
Thank you.
And I think that does conclude the Texas portion of the staff meetings. So you can all jump back on in a half hour for the Q&A portion.
Well, don't leave yet because, you know, Cameo always has something to say. So good afternoon, everyone.
Hello.
Hello. Hopefully my audio is okay. I'm going to turn off the video because my Wi-Fi is not that great where I'm at. But I just wanted to reiterate some of the shout outs that Hope provided throughout Texas. So Team Houston, I have been just absolutely inspired by this team. People coming together across processes, across departments, solving problems, helping customers. I know it has been challenging. I know we're not all the way through yet, but you can do it. You are doing it. So thank you. To the team in Dallas, did you see that year-over-year growth? That's phenomenal. You're there, you're helping more kids, and we couldn't be more pleased with that. So thank you to Dallas. And to San Antonio, you are definitely being collaborative and creative, definitely seeing some staffing shortages there that we'll look to solve and to fill in the gaps. But so appreciate you guys continuing to work together and really leading with best practices that you're sharing across the region of Texas. So thank you. And absolutely, Trish and Suzanne have extended themselves immensely, extended and stretched their capacity. So thank you for sharing your expertise. And as well to Shalmer and Alicia, you've done outstanding work in this last week to really dig into a project to help people help you dig into a project. So wanted to as well recognize that work. So thanks everyone. And I'll talk to you soon.
Thanks, everyone. Y'all have a blessed day. Talk to y'all soon.
Thank you.
Thank you so much.
Thank you. Bye,
See you
guys.
Thank you. Thank you. Thank you.